Good evening. Welcome to the inaugural Robert W. Rewoldt and Susan M. Rewoldt Nobel Laureate Lecture, sponsored by the Mayo Clinic Dolores Jean Lavin Center for Humanities and Medicine. I'd like to welcome those who are joining us remotely as well, watching this event live from home computers and other locations. My name is Paul Scanlon. I'm the Medical Director of the Lavin Center for Humanities and Medicine. The center supports the primary value of Mayo Clinic, the needs of the patient come first, by integrating the arts and other expressions of human culture into the healing environment of Mayo Clinic. Today we are honored to welcome Dr. James Orbinski, who's internationally recognized for his humanitarian activities and his expertise in global health as our presenter for the inaugural Rewoldt Nobel Laureate Lecture. Some of you may recall previous Nobel Laureate lectures at Mayo Clinic, including lectures by Peace Laureates Elie Wiesel in 1998 and 2002, and Archbishop Desmond Tutu in 2000. A gift from generous benefactors, Robert and Susan Rewoldt, presents an opportunity to revive these lectures again. We're deeply grateful for that opportunity. The Rewoldts are residents of Oregon and Iowa and longtime Mayo Clinic patients. Mr. Rewoldt credits Mayo Clinic with saving his life and his mother's life many times over. The endowed fund that makes this lecture series possible is given in honor of Mr. Rewoldt's parents, Martha and Fred Rewoldt. Mr. and Mrs. Rewoldt regret that they're unable to join us here this evening, but we understand they intended to log into the presentation from home and so may be watching us live right now. If you're with us, Mr. and Mrs. Rewoldt, thank you. We send our warm greetings and gratitude to you both. The Rewoldts are passionate advocates for peace, health, and in particular, engaging citizenry through direct democracy as practiced by the Swiss form of government. Dr. Orbinski served as international president of Médecins Sans Frontières, known in the U.S. by its English name, Doctors Without Borders, from 1998 to 2001. In 1999, MSF was awarded the Nobel Peace Prize in recognition of the organization's pioneering humanitarian work on several continents. As president, Dr. Orbinski accepted the prize on behalf of MSF. At the time, it was noted that MSF annually sends out 26,000 doctors and nurses to 80 countries and performs 6 million medical consultations and 200,000 surgical interventions per year, making it one of the world's largest emergency aid organizations. The connection to Switzerland is particularly relevant to today's lectures as MSF maintains its international offices in Geneva, Switzerland, from which its worldwide activities are coordinated. Dr. Orbinski's humanitarian work during the famine in Somalia and the genocide in Rwanda was featured in a powerful documentary film, Triage, that was shown at the 2008 Sundance Film Festival and was screened here earlier this month at the Rochester Public Library. Together with James Fraser, Dr. Orbinski co-founded Dignitas International in 2003. It's a Canadian-based medical humanitarian organization that increases access to effective HIV/AIDS-related prevention, treatment, care, and support in resource-limited settings. He's a full professor of medicine at the Dalla Lana School of Public Health at the University of Toronto, and he's also a senior fellow at the Massey College and the Munk School of Global Affairs. Dr. Orbinski is currently the CG Research Chair in Global Health at the Balsillie School of International Affairs at Laurier University. He's also part of the Laurier 2030 Plus group investigating relationships between global health, poverty, climate change, and development. He's author of the best-selling book, An Imperfect Offering, Humanitarianism in the 21st Century. He's a member of the Order of Ontario and an officer of the Order of Canada. These designations recognize his achievements and ongoing commitment to excellence in humanitarianism and global health. For his medical humanitarian leadership in Rwanda during the 1994 genocide, Dr. Orbinski was awarded the Meritorious Service Cross, which is Canada's highest civilian award. At the end of the lecture, if you have questions for Dr. Orbinski, there will be a session for questions. Please, the volunteers will be available. If you raise your hand, they will bring you a card and pencil so you can write your question. Please submit your questions to the volunteers, and we'll go through as many of those as we can. We ask that if you have anything to share about this lecture on social media, please use the hashtag MayoHumanities. And for those who use Twitter, Dr. Orbinski's handle is @JamesOrbinski, spelled with an I at the end, not a Y. This noon, Dr. Orbinski gave an inspiring lecture entitled Humanitarianism in War, Médecins Sans Frontières and Beyond. This evening, he will speak on the topic of equity and global health. Please join me in welcoming Dr. James Orbinski.
Thank you again, Doctor. Well, thank you very much, Dr. Scanlon. It's very much a pleasure to be here at the Mayo Clinic, and it's very much a pleasure to have been invited to give this inaugural Rewoldt lecture, and I'm particularly pleased to do so given the stated commitment of the Rewoldt family to open dialogue about issues related to peace, health, and government, and also open dialogue around the causes and conditions of war and to better citizenship and to better societies. Now, in my experience as a humanitarian doctor, I've seen famine, I've seen war, and I've seen war crimes, and I've seen genocide. And there is no escape from what you know. I speak tonight for myself and not for any organization. And I want to talk tonight about humanitarianism, its practice and some of its principles, and about humanitarian laws of war. And I want to do so from a very personal perspective. And I want to talk about leadership, and particularly in relation to the now global refugee crisis emanating from the Middle East and North Africa. Now, I have long believed that our greatest wealth as human beings is the degree to which we can be more humane, more fair, and more just to each other. And equity as a principle is key to humanitarian work. It assumes that all people are equal in worth and dignity. It approaches the pursuit of justice through fairness, and it essentially argues that people in similar situations should be treated similarly. Humanitarianism requires that we care for each other and that we act both for and with each other. Now, given global events over the last year, including the terrorist attacks in Paris, this has not been a good year for humanity. The Ebola epidemic exposed the fallacy of a global health architecture as the virus spread like wildfire through West Africa, infecting more than 27,000 people and killing more than 11,000 people. After a prolonged period of international indifference and, frankly, incompetence, the only thing that can spread faster than the Ebola virus is fear. The same risk now accrues in the face of ISIS. For Ebola, already too fragile and underfunded health systems collapsed, leaving millions unvaccinated and vulnerable to treatable diseases like HIV, tuberculosis, malaria, pneumonia, diarrhea, and measles. And like Ebola, ISIS is a scourge, but our fear of it must not overpower our capacity for humanitarianism. Even with the horrors of recent terrorist attacks in Paris, ISIS and its affiliates, like Boko Haram in Nigeria, have killed thousands more Muslims than Westerners. The civil war in Syria, with a population of 23 million, has left 11 million of those 23 million people displaced inside their country, and at least another 4 million as refugees outside of their country. 1 million of these Syrian refugees now make up fully 1/4 of the population of people in Lebanon. And yet, the reality is that humanitarian aid to the region is not growing, but in fact is shrinking. The World Food Programme cut its monthly stipend to refugees for food from $30 a month in 2014 to $13.50 a month in 2015 because of, quote, donor funding shortfalls, end of quote. Refugees are paying $50 a month for rent so that they can pitch a tent that they must call home. Families are sending their children out to work for 75 cents an hour to earn what it takes to stay alive in increasingly destitute camps. Fear for what may happen to their children in the camps is the #1 reason that Syrians are refugees and are sight for joining the tide to Europe. Hundreds of thousands of people risk their lives and the lives of their children daily to escape the devastation and war in Syria, in Iraq, in Libya, in Afghanistan, in Somalia, in Eritrea, Nigeria, and elsewhere in Africa. Some 750,000 people thus far this year have fled directly to Europe, by land and by sea. Nearly half of those are children, and many of those children are actually traveling alone. With the exception of Germany, Europe has met the most desperate people on the planet with inertia, with incompetence, and with outright hostility. The Prime Minister of Hungary is erecting a 13-foot-high fence across the Balkan border and has declared the right to, quote, shoot illegal migrants, quote, non-lethally, for whatever that means. The refugee crisis confronts Europe and the world with what can only be called an existential challenge. The Economist, in April of this year, wrote that, quote, Europe's boat people are a moral and a political disgrace for Europe and for the world. Its editorial stated, and I'm still quoting, that, quote, after the crimes of the Second World War, countries made solemn undertakings never again to abandon innocent people to persecution and conflict. Europe's boat people exposed the failings of countries with a duty to shelter them. And in Europe, that starts with a breakdown of ethics, end of quote. The United Nations High Commission for Refugees counts 59.5 million people worldwide who are displaced by war or who are refugees. And yet for its operations in the Syria region alone, it's asked for $4.8 billion a year from donor states, but it has received only $1.8 billion. Now, Simone Weil, in her commentary on Homer's Iliad, a commentary that she wrote in the summer of 1940, after the fall of France to the Nazis, remarked that a trembling marks those who now feel a nothingness in their own presence. It is a quivering of those who are reduced to a bare life that is no longer seen as inherently sacred. It is into this silent space that the humanitarian acts. And in speaking from this place, the voice of outrage is raised. It's a voice that bears witness to the plight of the victim, and one that demands for the victim both assistance and protection so that the silence does not go unheard. Now, the refusal to accept what is so clearly unacceptable is Médecins Sans Frontières' founding myth, and bearing witness is central to this founding myth. It's commonly acknowledged that Médecins Sans Frontières, or Doctors Without Borders, began in the context of the Biafran Civil War. French doctors, originally working with the French Red Cross, rejected a predetermined neutrality that imposed a passive complicity, if you will, with the Nigerian government, which had been accused of committing genocide in Biafra. The silence of all parties, including the Red Cross at the time, about the annihilation of Jews under the Third Reich formed the backdrop to this accusation and the backdrop to the founding myth that is MSF. Now, at its best, politics is an imperfect human project. It's at its worst when we delude ourselves in thinking that politics can and should be perfect. In Rwanda, in 1994, I was MSF's head of mission in Kigali, which is the country's capital city. It was a brutal, horrible time. It was a place of rational and state-planned evil. Over 1 million people, virtually all of them Tutsis, were butchered to death in 14 short weeks. And throughout the country, parents often paid to have their own children shot in open pit latrines rather than to see them murdered by being hacked to death with a machete. Bodies literally filled the streets of the capital city, and the gutters alongside a hospital that we managed to keep open literally ran red with human blood. And one night, after many long hours of surgery, a girl of about 9 told me how she escaped murder at the hands of the Interahamwe killing squads, as they were called. Through an interpreter, the little girl told me how she cried without noise and hid in the latrine and watched her parents being killed. Now, how do you have hope in the face of genocide? How do you see possibility? Well, it does not lie in naive utopian dreams. Hannah Arendt was one of the greatest political theorists of the 20th century. She was a Jew who, as a young woman, escaped the Nazi Reich in Germany to France, and then from a Nazi labor camp in France to New York. As an academic in New York, Hannah Arendt dedicated her entire life to trying to understand the origins of totalitarianism and the essential nature of politics and action as an antidote to the reemergence of totalitarianism. She argued that the first political act is not to claim one's rights, nor is it to claim protection under a political constitution. She argued, in fact, that the first political act is always simply to speak, and to speak the truth. And in Arendt's conception, speaking necessarily implies an equal willingness to listen. And both listening and speaking must be followed by action, by initiative, by doing. Now, many have described genocide and similar human cruelties as unspeakable. But they are as unspeakable as they are undoable. As human beings, we do genocide. And doctors cannot stop this crime, however well-intentioned they may be. But we had a responsibility to speak out against what we knew. And we did speak. We spoke with a clear intent to rouse the outrage of public consciousness around the world and to demand a politics that pursues justice by putting the dignity of the victim at its center. 20 years ago, when the genocide in Rwanda ended, there was no such thing as an international criminal court. In 2002, the ICC came into being. It has since issued many arrest warrants for alleged war criminals and has several significant convictions. It has also issued an arrest warrant for Mr. Omar al-Bashir, the president and the current sitting head of state for Sudan. He's charged with intentionally directing attacks against civilians in Darfur, with pillage, with murder, with extermination, with forcible transfer of civilians, with torture, and with the use of rape as a weapon of war. The creation of the ICC is a seminal, and I mean that word very, very precisely. It is a seminal and an imperfect human achievement. Now, for the first time in human history, those individuals who violate the laws of war can be held to account if their own governments fail to hold them to such account. Now, the ICC came into being because of the outrage of citizens like you and me who listened to what was spoken by organizations like Médecins Sans Frontières, Oxfam, Amnesty International, Human Rights Watch, and thousands of other organizations that met in churches, in schools, in community clubs, and on university campuses around the world. They acted. They organized, bringing together academics, jurists, some of the best political and legal minds in the world. They focused their mind, their time, and their energy. They applied rigorous analysis and explored alternatives in that messy and deeply imperfect process that we call politics. All spoke, all listened, and thought carefully. They posed alternatives, they demanded a better politics, and they sought out courageous politicians who came to the point where it was impossible to ignore the voice and the choice of citizens. Against all odds, against all naysayers, and against all pessimists, as human beings, we invented the ICC. And now, even with its current imperfections that must be corrected, including the fact that China, India, Russia, and the United States have not yet signed its statutes, it's absolutely clear that no one, not even a sitting head of state, can claim to be above the law. Now, as a humanitarian doctor, I've witnessed far too many times that trembling that Simone Weil talked about, that trembling that marks those who now feel a nothingness in their own presence. In 1992, I was in a Médecins Sans Frontières compound in Baidoa, Somalia, that was surrounded by warlords firing RPGs and anti-aircraft guns at each other. Our compound took several hits, and I took cover behind a cement wall. In the aftermath, I did my best to treat the many civilians and combatants who were wounded. In 1994, both the ICRC hospital, the Red Cross hospital, and the King Faisal hospital in Kigali were the targets of intense shelling throughout the genocide and the Civil War. And I worked as a doctor in both hospitals and remember all too vividly taking cover in each at different times as shells rained down on our humanitarian workers and our patients, wounding and killing many. In such moments, there is nothing more real than the overwhelming vulnerability to the raw power of unbridled violence. Now, on October 3rd of this year, in Kunduz, Afghanistan, American forces dropped bombs on an MSF hospital. The GPS coordinates of the hospital had been given by MSF to US forces in advance to prevent such an attack. And yet bombs repeatedly targeted the main hospital building, housing the intensive care unit, the emergency room, and the physiotherapy ward. And despite notification by MSF, further airstrikes came, approximately every 15 minutes for another 30 minutes. So precise and consistent were the waves of bombing that surrounding wards and buildings were in fact not hit. In all, the bombing continued for more than an hour. There's no fog of war here. 12 MSF staff members and 10 patients were killed. There were children, 3 were children, and most of the 10 burned alive in their hospital beds. 37 more people were injured, including 19 additional members of the MSF medical team. Now, what happened to create a hell in a so-called humanitarian hospital? I am all but sure that the MSF aid workers at Kunduz felt that trembling that marks those who now feel a nothingness in their own presence. It's a quivering of those who are reduced to a bare life that is, in fact, no longer sacred. It's very much, as I said earlier, into this silent space that the humanitarian acts, to acknowledge the dignity of the other, and especially when he or she is most vulnerable. My own work over the last 25 years has meant practical medical humanitarian efforts aimed at the relief of suffering while supporting people's right to be agents in their own destiny. And in speaking from this place, the voice of outrage is in fact sometimes raised. Why was the hospital obviously targeted, hit, and then hit repeatedly? The American forces have changed their version of events at least 4 times. President Obama called the head of MSF to apologize and offer his condolences. The Pentagon has pledged to pay compensation, but none of this, frankly, is good enough. If the use of force in war, however necessary it may sometimes be, is to be something other than unbridled violence, it must be proportionate, it must discriminate between combatants and civilians, and it must be accountable. And in all cases, belligerents are responsible for ensuring the safety and protection of civilians, and for allowing humanitarian assistance to people in need. These basic principles are enshrined in international humanitarian law, also known as the laws of war. Under international humanitarian law, hospitals in conflict zones are protected spaces. Until proven otherwise, the events of last month in Kunduz amount to an inexcusable violation of this law. We need to know how this humanitarian hell was created, who is responsible, and who is accountable. Until then, the public facts suggest nothing short of a war crime. Nothing less than a full, public, independent investigation is required so that exactly what happened is completely clear, and so that mistakes, if any, can be acknowledged, apologies made, compensation paid, and redress made within U.S. forces combat procedures to ensure that something like this never happens again. And so that if there were only some or no mistake made, any culprits involved in what must be an intentional act are identified and brought to justice. MSF has, and rightly so in my view, called not for an internal investigation by the U.S. military, but for an independent humanitarian fact-finding commission to be convened under the authority of Article 90 of the Geneva Conventions. Now, humanitarianism is not only about war and those who seek refuge from it. In January of 2000, I was in South Africa at a Médecins Sans Frontières AIDS clinic, and I was examining a 20-year-old man who, if he were here or virtually anywhere else in the Western world, he would just be starting his life. This is a picture of a person, a young man, about 20 years old, who is dying of AIDS. This is a picture of that same young man 6 months later, after having received 6 months of life-saving antiretroviral treatment. Patented drugs to treat AIDS were available at that time in the Western world, but at a cost of more than $13,000 US a year per patient per treatment. There wasn't a hope in hell that anyone like this young man in the developing world would get them. The young man that I was examining had an AIDS-related pneumonia and was so weak that his mother and his grandmother had to help him up onto the examining table. And as he sat there gasping for air, he asked me some very simple questions, questions that I believe get to the heart of inequity around the HIV/AIDS pandemic. He asked me, and I quote, "Why do you come here with only kindness when what I need is medicine to stop this AIDS? Your kindness is good, but it will not help this AIDS. They have such medicines in your countries. Why not here in South Africa for people like me?" Now, as you know, AIDS is a fully treatable disease. It's as treatable as diabetes. And yet today, more than 25 million people have died of the disease worldwide. Over 33 million people now live with HIV infection. And under current projections, at least another 40 million will be infected by 2025. And almost all are in the developing world. Now, how do you have hope in the face of an epidemic like AIDS? How do you see possibility when charity is simply not good enough? At that clinic in South Africa, MSF, in a public act of civil disobedience, was about to begin treatment by publicly and illegally importing AIDS drugs into South Africa. It was in listening and seeing the dignity of people like this young South African man that MSF began its Access to Essential Medicines campaign. As then president of MSF, I had the privilege of launching that campaign, and it was a challenge to a failing politics. We acted, and we were not alone. It was exactly the same process that I've previously described. We brought together academics, the best scientific, business, and political and legal scholars in the world. We focused our minds, our time, and our energy. We applied rigorous analysis and engaged debate. We experimented with options, and we identified alternatives. We mobilized a coalition of citizens groups from around the world. We worked with like-minded nation states and with like-minded private sector pharmaceutical companies. We publicly shamed pharmaceutical companies and governments that supported the privilege of profit over people's right to exist. We pooled our purchasing power and we bought generic versions of AIDS drugs. By 2001, we had brought the market price for the treatment of AIDS down from over $13,000 US per patient per treatment per year for patented versions of antiretrovirals to less than $200 for generic versions of exactly the same medicines. Today, the cost of those medicines is about $64 US per patient, per treatment, per year. Against all odds, against all naysayers, and against all pessimists, there are today now more than 10 million people on full treatment for HIV in the developing world. And despite the apparently dire, the most dire of predictions, the pharmaceutical industry did not collapse. Now, 2 months ago, I was in Malawi with Dignitas International, which is an organization that I co-founded in 2004. It's focused on strengthening health systems for the care of people with HIV, with tuberculosis, and with non-communicable diseases. It's focused on improving primary health care for people in the developing world. When we started the organization at my hospital, St. Michael's Hospital at the University of Toronto, entire villages had collapsed in the despair and hopelessness of rampant disease. 90% of hospital admissions were HIV positive, and people literally languished and died in the shade of trees surrounding the Zomba Central Hospital. Why did we focus on primary health care? Because by working hand in hand with the Ministry of Health and supporting people with HIV and TB and other primary health care needs, individuals and communities can face their health needs on their own terms. We're working, why are we working with the Ministry of Health? Because charity poses the danger of making itself indispensable by being too competent in doing a job that should be systematically embedded. Charity must not become a substitute for government responsibility. And indeed, there's no substitute for good government or for good governance. We're working with the Malawian Ministry of Health, the University of Malawi, the University of Toronto, Cape Town University, MSF, Partners in Health at Harvard, to research and develop highly simplified training and treatment algorithms for the treatment of non-medical professionals, for treatment by non-medical professionals, like nurses, community health workers, who have as little as a grade 9 education. And as you well know, just because you're not educated does not mean you're not smart. With the right tools and the right training, it is absolutely possible to train non-medical people to diagnose, to treat, and to manage diseases like HIV, TB, and diabetes. In Malawi, we're training and mentoring more than 500 healthcare workers a year and are supporting systematically embedded research on how best to enable women's groups, groups of orphans, and groups of people living with HIV. We're also deeply engaged in a systematic research program that is a structural part of the organization. We do research on clinical outcomes, research on health systems, and research on training and mentoring. In full partnership with the Ministry of Health, we've started now more than 260,000 people in Malawi, more than half of all people on treatment for AIDS, through more than 150 remote village clinics throughout the country. And we work intensely in 3 hospitals in the southwestern zone of the country. As of last year, working with Cree Indian bands in northern Canada, with the Northern Ontario School of Medicine and the University of Toronto and the Ontario Ministry of Health, we're taking some of the things that we've learned in Malawi and we are applying them to remote, rural, Aboriginal communities in Canada. Those communities suffer some of the most egregious health inequities in my country, in Canada. And I know the situation is not so different here in the United States. We're developing a program that's focused on Aboriginal health in Northern Ontario. And we've published more than 50 papers, some of which is recognized by The Lancet and by people like Bill Clinton as some of the best HIV research in the world. Malawian and University of Toronto graduate students have gone on to take leadership roles in the Ministry of Health, in Malawi, in South Africa, and at the World Health Organization. And now in Malawi itself, villages are back at work, and people's primary concern, as it should be, is the education of their children. Now elsewhere in Malawi, not just in Zomba, but in other parts of the country, one of the major dominant issues that people are facing is chronic food shortage. Because of extreme weather events, drought and flooding brought on by climate change, food shortage is now a major issue, not simply in Malawi, but in the entire southern region of Africa. In 2011, the drought and famine in East Africa left 13 million people in need of food assistance. It also left 500,000 people dead. And the drought has been directly attributed to climate change. A mere 10 years from now, crop yields in some parts of Africa are expected to drop by 50%, and water stress could affect as many as 250 million Africans. The problems that we now see across North Africa pale in comparison to what may yet be coming down the pipeline. Exactly the same process is true for Central America and for Southeast Asia. Here in North America, West Nile virus, never seen before the year 2000, has infected more than 21,000 people, and it has killed more than 800 people in the United States and Canada. The Canadian government has warned that Canada might eventually experience yellow fever and malaria. And Lyme disease has moved north up through the United States, and dengue fever is following, all because of climate change. Indeed, The Lancet has recognized that climate change is the greatest global health threat of the 21st century. We come full circle, ladies and gentlemen, when we realize that it is climate change that drives competition for access to water and arable land in Darfur, Sudan, and that leads today to war crimes, to crimes against humanity, and to what some have described as slow-motion genocide. Indeed, even the editorial board of the Financial Times has dryly noted that, quote, simply letting climate change rip and tidying up the damage as it occurs is not an enviable strategy. In poor countries, and I'm still quoting, higher temperatures will mean an increased risk of hardship and societal collapse, and rich countries will be forced to respond one way or another. Now, we are today in the midst of converging global crises in food, in fuel, in climate, in economy, and most especially in governance. Each of the crises that I've touched on have both local and global causes, are interdependent, and we know all too clearly have highly contagious global consequences. We're at a moment in our human story where we must face squarely the unavoidable complexity, interdependency, and fragility of our human condition. We have become our own geological epoch, the Anthropocene as it's now called, where human pressures on the planet are at risk of triggering abrupt and irreversible changes with potentially catastrophic outcomes for human societies. We've already crossed at least 3 of 9 planetary boundaries or tipping points. And we must recognize that our global context has fundamentally changed. We are no longer in a mid-20th century world. Our governance structures are designed for a mid-20th century world. We are now well into the second decade of the 21st century. Our population is 7.4 billion. We are adding 1 billion people to the planet every 13 years. We are in the midst of a process of massive urbanization, where at least 50% of the human population now lives in cities. Within 15 short years, that number could well be upwards of 70%. Louis Pasteur, who discovered the microbe, said some 150 years ago that, quote, the microbe is nothing. Its terrain is everything, understanding the context in which the microbe exists is fundamental to understanding the microbe itself. The implications of this now globally complex and increasingly fragile context for human, for animal, and for planetary health are staggering, to say the least. We need new approaches and we need new thinking. And much as we might hope otherwise, we know that good planets, even a bit damaged, are hard to find. There's no escape from our biosphere. It is the only place that we live. And yet we are changing it so that it is unlivable for many, and especially those who are the poorest and already the most marginalized. And there's no escape from each other. I know that if my children are to live free, just, and fair lives, then all children everywhere must also have the same opportunity to live free, just, and fair lives. The dignity of each and equity for all must be a guiding maxim. This is not new, but it requires a new commitment. We need to newly commit to this way of seeing ourselves in relation to each other and in relation to our shared place in our biosphere. This has much to do with humility. It means recognizing the other. It means seeing the sameness of self and difference to self, and seeing and defining oneself in relationship to the other. It does not mean a complete erasure or subordination of the self, but a recognition that, as the African proverb goes, that I am because we are. We need now to live this consciously in relationship to each other and in relationship to our ecosphere. And we need to rediscover old forms and find new forms in language, in story, and in culture to express this. Now let me conclude by saying something about those among us who have the ability to respond, something about leadership and responsibility. And let me do so by returning to the global refugee crisis. The Muslims who flee the terror of ISIS or President Assad, they are fleeing for their lives. They are desperate people seeking refuge. They are refugees. To reject refugees is to make the victims of terrorism equal to terrorists. Refugees, then, are victimized twice. And this is not just unfortunate for them. It is precisely this that ISIS wants, for it strengthens their narrative that ultimately the West, us, deep down, actually hates Islam, and that the West is therefore worthy itself of being rejected and being targeted by Islam, and that only a true Islamic caliphate can protect Islam. It's a narrative that is distorted. It is a narrative that is fundamentally wrong. Choosing Christian refugees is even worse. It's to choose good victims, Christians, and to reject bad victims, Muslims. Now recently, at a reception center for asylum seekers, Angela Merkel, the president of Germany, boldly stated that there can be no tolerance of those who question the dignity of other people. She was standing in the spot where right-wing extremists battled police a week earlier. She said, and I'm quoting, "There is not tolerance of those who are not ready to help, where legal and humanitarian reasons demand that help is due." Germany, a country of 70 million people, has pledged to receive 1 million asylum seekers by the end of the year. How ironic that the birthplace of the Third Reich is today the dream destination of asylum seekers the world over. Leadership, ladies and gentlemen, means stepping up and stepping out with an authenticity and a clarity of purpose. It means a willingness to engage debate, to make choices, to speak, to listen, to take initiative, and to make choices and to do in a pluralist world. There are many types of leaders driven by as many different ambitions. All need a healthy ego, all need thick skin and a surety of purpose. The best among them, however, are ethically driven, rooted in the dignity of the other, and are pragmatically committed to making our world more just, more fair, and more equitable. The best among them are authentic, and they are as willing to fail as they are to succeed. The best among them, too, realize that a genuinely effective leader actually follows the energies and capabilities of others and attempts to articulate and therefore inspire toward a common vision. The transitional, quote-unquote, postmodern world that we now inhabit was recently described as one where everything is possible, but nothing is certain. The best among leaders support others to be their best selves so that their capabilities become abilities. And the best among them does so with a lightness of heart and a sense of humor, for this is often the only salve to a failing or at best uncertain situation. The best among leaders, too, they know that vision and words matter, but they also know what you do matters most. And most importantly, the best among them know the difference between hope and optimism. Optimism is the expectation, based on the evidence at hand, that there's a reasonable chance of a good outcome. Hope, on the other hand, is the certainty that a given action is right, that it makes sense, that it is the right thing to do, regardless of how the situation might turn out. Now, Vaclav Havel, the playwright, the political dissident, and then president of Czechoslovakia, he knew this distinction. In a letter to his wife, written from solitary confinement in prison, he noted that while he was not optimistic about his and his country's then current circumstances, he was deeply hopeful because he had done the right thing. And he knew that others would find the courage to themselves do the right thing, despite the less than optimistic circumstances. If we do the right thing, if we are hopeful, we can, through our actions and their effects, we can actually create the conditions necessary for optimism. And finally, the best among leaders know that courage begets courage. A few years after Havel wrote that letter to his wife from solitary confinement, he was elected the first president of the post-communist Czechoslovakian Republic. The task, ladies and gentlemen, of making our world more fair, more humane, more just is for each of us, and it is very much our task today. Thank you. Thank you. Thank you very much.
And that's not all. We have the opportunity for questions. We've got several coming. Dr. Orbinski, while we're waiting for the questions to come up, time wouldn't allow a thorough addressing the issue, but I was intrigued by your description of your 3 priorities in your mere 3 years as president of Médecins Sans Frontières. It was a tremendous achievement. Could you describe those briefly?
Yeah, earlier in the day, I met with a group of medical students, and we talked about some of the things that I've been involved in over the years. And in the process of that talk, one of the questions was, what were your leadership choices when you became president of MSF? What I talked about was 3 things. One was ensuring the independence, the neutrality, and the impartiality of MSF. And at that time, while the majority of funding for MSF was through private donations, a significant portion of funding was still state-based. And to be fully independent of donor states, particularly in emergency situations, one needs to have an independent capital flow, an emergency fund that you can use to deploy resources, and so that you don't have to go to states and ask them for money so that you can provide humanitarian assistance in a war or in a situation of crisis. If you do have to rely on such donor funding, then your independence, your impartiality, and your neutrality is open to question. So one of the priorities at that time was to create an independent emergency fund for MSF. And through a series of financial mechanisms, we were able to do that. I highlighted that for medical students because I wanted them to understand that providing humanitarian assistance and excellent medical care is certainly about technical knowledge and medical knowledge, but it's also about understanding the organizational framework in which you operate and understanding the parameters and constraints that affect an organization, and particularly finance, and that is particularly relevant in a situation of war and conflict. A second focus was to narrow the operational scope of MSF. At that time, MSF was involved in many, many different activities that were beyond the specific scope of direct medical humanitarian assistance, either clinical or public health or water and sanitation. And so a priority was to narrow that scope and eliminate those activities that don't fall within that defined range. And that's important because, again, your operational capacity and your organizational capacity has a limited bandwidth. The mind and the time and the energy of the core people within your organization can only be consumed with and can only achieve appropriate excellence or an appropriate standard of care around a very specific domain of knowledge and practice. And that's not to say that other domains aren't relevant or important. But what we did was we essentially hived off a whole range of other activities and then supported other organizations in developing their capacity to do so. And then the final thing that we focused on was on ensuring that the governance of the organization was directly rooted in the membership of the organization, in the associational membership that then elects board members that then govern executive decision makers. And that governance mechanism is extremely important because it ensures that the direction of the organization is rooted in the experience of the organization, the lived experience of association members who have field experience, who have worked with the organization, and who understand the basic ethos and the basic reality that the organization confronts on a regular basis. So those are some of the priorities that we focused on.
Great. Questions from the crowd. What are the global responsibilities of institutions like Mayo Clinic?
What are the global responsibilities of institutions like the Mayo Clinic? I think the Mayo Clinic is one of the world's outstanding research facilities and one of the world's outstanding educational and clinical care facilities. It represents the very pinnacle, if you will, of Western medical competence and capacity. It represents a commitment to excellence in each of those three domains, in research, in service, and in education. In my view, the Mayo Clinic should keep doing what the Mayo Clinic is doing. It should maintain that capacity and maintain that commitment, that deep and unabiding commitment, or abiding commitment to excellence. It should also, and I know that this is happening through various people that I've talked with over the day, it should also seek to partner with other institutions in other parts of the world, and primarily in the non-Western, non-OECD developing world, and develop relationships and concrete partnerships around each of those three areas, so that the best of the West is brought to bear in the developing world, and the realities and the competencies. There are incredible competencies in terms of research, in terms of service, and in terms of education in the developing world can be brought to bear here at the Mayo Clinic. And so that together, a new understanding of shared, common global health challenges can emerge. And the Mayo Clinic has made enormous contributions to biomedical science, to teaching and to research. And I believe that with the right relationships, it can continue to do so, and it can make even greater relationship benefit and contributions to global health writ large.
Thank you. What is the single most effective tactic to combat radicalized terrorism?
What is the single most effective tactic to combat radicalized terrorism? I would say that the single most effective mechanism is a long-term mechanism. It's a mechanism that is committed to basic equity and to basic justice in all that we do, whether that's economically, whether that's politically, whether that's through the pursuit of medical domains of knowledge, a commitment to equity, a commitment to seeing each human being as fundamentally equal and as fundamentally worthy of the attention of human society. I think if that were a driving vision, that in itself, over the long term, would fundamentally change the disaffection that has led to radicalized terrorism. And it would fundamentally change the nature of inclusion for a large number of people who are now currently disaffected. It is a long-term vision, and it is a vision that I think must underpin political, economic, and, when necessary, military activity to actually address the threats that are before the world.
Chance to pitch your book. When can we expect a book? Could you just briefly name your book?
I don't want to give you the name. My editor has told me not to do that.
I did.
Because I have to tell you, it's such a great name. A great title. Someone else will steal it. But I did write a book that was published in 2009 by, you can get it through Amazon here in the States with Bloomsbury. And it's called An Imperfect Offering, Humanitarian Action for the 21st Century. And that's widely available. It's available in 5 different languages. You can easily find it.
What effect would a lesser world population through birth control have on most of the global problems you mentioned? Why is this possible solution talked about so little?
So I think there's no question that we have to confront our population numbers. And we have to do so in a way that is viable and meaningful and actually achieves the results that we're looking for. There's also no question that availability of birth control is a key factor. But there's also no question that it's the least of key factors that can actually affect population growth. We know from very good evidence, very good research, very good analysis,
that the single most important intervention that can reduce population within one generation is one simple thing, which is the education of girls and women so that they are brought to an equal status with men around the world. If we invested an appropriate amount of money in that global generational challenge, the impacts of that intervention would have consequences far in excess of the immediate goal of reducing population. It would have consequences for political stability. It would have consequences for economic viability. It would have consequences for new forms of society that can only be of benefit to all of us.
For a young person entering the professional world, what advice would you give on starting or pursuing a career in humanitarian health work?
I would give very concrete advice. I would say, number one, learn and master your domain of knowledge, whether it's medicine, whether it's nursing, whether it's epidemiology, whatever it is. Learn and master your domain of knowledge. The second thing that I would say is learn a second language. Learn the language of the place or the region to which you feel drawn or to which you have some interest in working in. Language is a window to culture. Not all cultures vary as people vary. If you can see through the window, through language, you can see that not all of us see the world in the same way. And if you can see that the other doesn't see the world in exactly the way you do or your culture does, and if you can do that in a manner that is basically respectful of the other, then you are well positioned to make a major contribution to changing the face of global health. And then the third thing that I would say, so first, master your domain of knowledge. Secondly, acquire a second language, and really acquire a second language. And thirdly, learn a concrete skill. Something concrete that you can do, that you can give, that you can bring to bear on a particular situation. Applied skills in whatever it is, surgery, epidemiology, accounting, political science, policy analysis. It doesn't matter what it is, but applied concrete skills. There's nothing worse. I shouldn't say nothing worse. There's a lot of things worse. There's nothing that's sometimes, well, this, one of the things you want to avoid is being that person who has good intentions, but who is not a master of their domain of knowledge, does not know the language of the place in which he or she is working, and doesn't have anything concrete to offer. Good intentions are good, but they are not good enough. You need to be able to speak the language, to think clearly through your domain of knowledge or expertise, and to be able to do something concrete.
Thank you. What 3 simple practical strategies could the average person adopt in their everyday lives to make a difference in the world?
Well, I think you should maybe talk to somebody else about that. What 3 simple strategies? Well, I mean, we're all so different, and we're in different circumstances, so it's very difficult to be kind of universally prescriptive. But I would say something akin to what I had said to the medical students earlier this afternoon. Number one, feed your curiosity. Curiosity, the desire to learn, the desire to learn from success, but also from failure, keeps you alive and engaged in the world. It keeps you dreaming. It keeps you doing. So feed your curiosity, I think, is the first thing I would say. And then the second thing I would say is cultivate humility. because not everybody sees the world the way you do. And you're not always right. You often are, but not always. And being humble in relationship to other people is a very good starting point and a very good way to be in relationship to other people in a manner that is genuinely equitable, genuinely respectful, and genuinely meaningful. And the third one, I would say, I'm just thinking of the guy who was encountered the genie who said, "You have one wish," and he said, "I'll wish for 1,000 wishes." Right? The third one is you get to wish, and you get to choose your particular characteristic that you want to cultivate.
Great, thank you. What possibilities are there for MSF to partner with other NGOs such as the Gates Foundation and many others? Is there responsibility thereby impact, or sorry, is there neutrality impacted by this?
Well, so MSF partners with all kinds of organizations all the time. The DNDI, the Drugs for Neglected Diseases Initiative, which is a not-for-profit drug development company that MSF created in 2004, and now is 10 years old and has created 2 new treatments for 2 fixed-dose combination antimalarials, a new treatment for schistosomiasis, a new treatment for pediatric Chagas disease, is working on pediatric antiretroviral formulations, and has 17 other drug compounds in its pipeline. That organization is completely alive in partnership with the private sector, in partnership with the Gates Foundation. The Gates Foundation is one of the major funders of the DNDI, in partnership with nation states, the French government, the Spanish government, the Brazilian, the South African, the Indian, the American government through NIH. So partnership is an inherent sort of quality, if you will, of any kind of active engagement in global health. And MSF, being a major actor, obviously engages in partnership. One has to be selective according to the circumstances you're working in and according to what are the dominant issues. And an entity that is not a partner today can easily be a partner tomorrow. An entity that is a partner today because of their choices or their actions may not be a partner tomorrow. So, one of the things that's kind of inherent or embedded in the question is an issue I think is quite important. These ideas of neutrality, impartiality, and independence, these are really important principles, but they're not to be deified, right, in and of themselves. They're tools that allow you to do certain things in certain kinds of situations. So in situations of conflict, in situations of warfare, they become extremely precious and extremely important to guide behavior. One doesn't take an action because it's neutral. One doesn't take a position because it keeps you independent. One doesn't pursue something because it makes you impartial. One uses impartiality, independence, and neutrality to achieve certain outcomes. Right? So it's the other way around. And I just point that out because there's usually very little opportunity to point out that in very, very apparently subtle but extremely important conceptual understanding of basic humanitarian principles.
Okay. We've got a number of good questions, but unfortunately we're getting close on time, so one more. Close calls with death and its impact on your work and your resolve to do your work. That is to say, have you had close calls with death, and how does that impact your resolve to do your work?
I have. I described some of them in my talk. It's not something that one seeks out. It's important to recognize that organizations like MSF, like the Red Cross, are extremely careful, extremely meticulous about safety and security. And this is why adhering to basic humanitarian principles and making sure that international humanitarian law, particularly in warfare, is respected. Putting people into situations where it is absolutely clear that humanitarian law is not respected is fundamentally irresponsible. Taking a young volunteer or doctor or young volunteer nurse or volunteer logistician who is filled with obviously knowledge, second language, and skill, but also good intention, and taking that and putting it in that energy and putting it in a position where they're fundamentally unprotected is not right. And so safety and security are major, major preoccupations for humanitarian organizations. One seeks to understand and then manage risk. And if it's not possible to understand a context or to manage risk in a particular context, then it's not possible to work. Now there are extreme situations that have occurred. I talked about a couple of them. But this is why, for example, the bombing of the hospital in Afghanistan and ensuring accountability around that, this is why this is so important. Because without accountability, what it means is that the gloves are off for all belligerents all over the world. If the United States military can do that and get away with it with a simple apology and with a statement that it will investigate internally, what it means is that the rules of war, even as seen and practiced by the most powerful military in the history of the world, those rules they're just nice ideas. Right? So the safety and security is a fundamental preoccupation of humanitarian organizations. Calling into effect international humanitarian law and the laws of war is a vital component to ensuring the safety and security of aid workers. And of, most importantly, of civilians, of people who are like the refugees that I previously described.
Thank you, Dr. Orbinski. This was a wonderful evening.
Pleasure. Thank you.
Thank you. Thank you also to the audience, and I'd like to reiterate our thanks to Robert and Susan Rewoldt for making this evening possible. We're deeply grateful for their generous support and for their commitment to advocacy for peace, health, and citizen engagement through direct democracy. Ladies and gentlemen, if you have the opportunity, please, we would like your feedback through the surveys that were in your programs. Those you can return to the volunteers or by email to humanitiesrochester@mayo.edu. And we would also invite Mayo employees to continue the conversation at the Discussion and Diversity Panel this Friday, November 20th, hosted by the Mayo Clinic College of Education Diversity Office. Flyers are available just outside the doors. So thank you once again for attending.